As health officials scramble to contain the outbreak,
we're seeing cases pop up right across New South Wales.
As the state's virus fight spirals deeper into chaos.
Working on the frontline during this pandemic has been extremely challenging.
I knew 2020 was going to be the year of the nurse. This was definitely not what I had in mind.
It has been quite scary. We didn't know what was happening. We didn't know what was coming.
The news was just getting worse and worse.
There's been a spike in infections in the past 24 hours.
You see all the news coverage of overseas and you think, oh my God, is it going to happen to us? Are we going to have enough staff? Are we going to have enough equipment?
Well, some of our frontline health workers say they are too scared to go home to their families.
There was that mood of that we were really in something big together.
We're a strong nation. We're a strong people. In the months ahead, we're going to find out just how strong we are.
Digital health has underpinned all of our response to COVID-19. It's enabled us to provide more flexible care to a larger number of patients across the hospital and health service.
By March 18th, I had to shut my program down. Very quickly, we needed to switch to some other mode of providing cardiac rehab to people. Telehealth came to mind. I think one of the key things about the telehealth has been just avoiding that unnecessary exposure so that the patient isn't worried about coming in and being exposed to what we might have in the hospital, but we are also not being exposed to people coming in from all different areas.
The benefits of telehealth cannot be understated. More than 75% of patients have really benefited from telemedicine.
The pandemic has been a catalyst for transformative change. We have been able to continue to provide care to patients who are vulnerable. The outcome for patients has been amazing.
Being able to access my health record, having digital access to their information really helps us provide the care that the patients need.
That digital information that you have can absolutely save lives. Digital technology has really made our ability to do our jobs so much easier.
Digital health gives us time. It gives patients time. It's saving everybody time. And it also is allowing for increased safety and vigilance around these platforms as well.
I would hate to go back to paper and pen. It's the way of the future, and I think it will only, as it expands, will get better and better, improve for everybody, the taxpayer, the patient, everybody.
Throughout our pandemic response, our nurses and all of our clinical staff, and even our non-clinical staff, have put themselves right on the front line. They have put their own safety aside to make sure that we are prepared and that as a community and a country we're prepared to respond to the unknown.
It feels like we are all in this together.
I have nothing but praise for our team here. No one's complained, everyone's got on and got it done and made it work, and that's just amazing.
You're all doing an amazing job. Stay strong, keep going.
Keep on going.
We're all in this together.
Together, we can beat this.
A real shout out to those frontline workers. My wife is a nurse and a midwife. I know the pressure she's been under in relation to this in a very personal way, so thank you to her and thank you to all of her colleagues all around Australia for the care that you give every day and that extraordinary work that you do on the front line. We really appreciate it.